There have been a number of recent controversial reports about dietary fat and heart health, in some cases causing unnecessary confusion. Our discussion will be about why these issues have resurfaced and how to sort the facts from the hype. Hi, I'm Dr. Alice Lichtenstein, Gershoff Professor of Nutrition Science and Policy at the Friedman School and Director of the Cardiovascular Nutrition Laboratory at the Jean Mayer USDA Human Nutrition Research Center on Aging at Tufts University. When we think about dietary fat, we frequently think about body weight and heart health. In the 1990s, the general advice was to cut the fat out of the diet. This approach did not result in a decrease in body weight and did not improve markers of heart health. In fact, it may have contributed to the obesity epidemic and the deterioration of plasma lipid levels. Worse yet, we saw a proliferation of fat-free foods that quickly became synonymous with low calories, and at times our appetite actually outstripped their availability. For the most part, foods like fat-free cookies, crackers, and ice cream were not particularly low in calories and sometimes tricked us into false security, assuming that fat-free meant calorie-free. At the beginning of the 2000s, in light of the experiences of the 1990s and new scientific data, all dietary guidance shifted from low-fat to moderate fat. Whether delivered as federal policy or from health advocacy organizations such as the American Heart Association. The basis for the shift from low fat to moderate fat is that total fat content of the diet has little effect on body weight, and moderate fat diets result in the most favorable heart disease risk factors, particularly HDL cholesterol and triglyceride levels. The emphasis is now on type of fat, where much of the current controversy resides, and also dietary patterns. So let's talk about type of fat. Do we need to be concerned about saturated fat? The simple answer is yes. The most accurate answer is a bit more complex. Substituting polyunsaturated fat for saturated fat is associated with lower risk of heart disease and better heart disease risk factors. However, substituting carbohydrate for saturated fat is not associated with lower risk of heart disease and better heart disease risk factors. So what does this tell us? First, we should not be talking about the individual components of the diet in isolation. When the saturated fat content of the diet goes up or down, so does something else in the diet. We need to be mindful of what else changes. One way to do this is to think more about dietary patterns. That allows us to take the whole picture into account. What should we do from a dietary perspective to protect our hearts? We should limit intake of foods that are high in saturated fat, which comes primarily from meat and dairy fat. This does not mean that we can't enjoy meat or dairy products, but we should choose wisely. This is relatively easy because lean cuts of meat are readily available, and there's a wide range of fat-free and low-fat dairy products in the market. And of course, it's always important to watch portion size. Finding out how much saturated fat is in foods you regularly eat is easier than ever before because the information is on the nutrient facts label, even for fresh meats. The other side of the coin is ensuring a good supply of polyunsaturated fat in your diet. These are the good fats that we shouldn't be afraid to eat. This means cooking with oils that are high in polyunsaturated fats, such as soybean oil and corn oil. It also means using these oils to make foods such as salad dressings and purchasing foods where the first oil listed in the ingredient list is an oil that's high in polyunsaturated fats. The best dietary advice we can provide to decrease risk of heart disease is to follow a dietary pattern that emphasizes vegetables, fruits, and whole grains, includes low-fat and non-fat dairy products, poultry, fish, legumes, that is beans, vegetable oils, and nuts, and limit intake of sweets, sugar-sweetened beverages, and processed meats. And of course, This dietary pattern will be most effective when eaten in amounts that achieve and maintain a healthy body weight. Regular exercise, like taking a walk, or another activity that gets us moving, can help keep our weight in a healthy range.